Next is Dr. Kate Kapalo, who's been a big friend and helped the Defense Council for a long time. Kate?
Thank you. Good afternoon, everyone. I appreciate the opportunity to speak to you today. Unfortunately, Chief Downs couldn't make it, so you're stuck with me. I apologize. For those of you who don't know me, I'm Kate Kapalo. I have a background in human factors. I started my career as a civilian research psychologist working with Top Gun pilots, F-18 pilots. And so I really have a deep understanding of how human factors impact decision-making in the fire service. But I'm also speaking to you today from a unique perspective. I'm a researcher by trade, but I'm also a cancer survivor. And I am not a firefighter, but I do bring that to the table in terms of thinking about how are we impacting our firefighters through minimizing cancer exposure, reducing health risks, those kinds of things and scenarios. But really what I wanted to touch on today is I am the Deputy Director, newly minted, of the DC Fire and EMS Department. And we're going to talk about a little bit about how we're running a study on biometrics and supporting our workforce and their health and safety through this project that we're working on. So today I'm presenting to you the fire isn't waiting on you, but our health and safety in the fire service is. So I'm reaching out to all of you as firefighters, as fire service leaders, as people in this technology space. We need your support. We need you to research these problems. We need to think about these things because they impact our members directly. So I don't want to belabor the statistics. We know that cancer and cardiac issues are killing firefighters. We know that when we look at the line of duty death data, there's a lot of different things that go into it. But Brunacini once said that accidents happen fast, but the things that lead up to accidents happen slowly. And this is really true when we expose our members to these different health risks in the fire service. That buildup of these different issues becomes insurmountable. It becomes a problem. And so when we talked through this at DC, we actually had this close to home. So we had 3 different members in our department who were diagnosed with cardiac issues, severe cardiac issues. They were in their 40s, they were relatively healthy, and we're talking about we met all the NFPA standards. We're DC. So they do their physicals, they do an annual stress test, they've got all that information, and this still resulted in cardiac arrest of these 3 members. One of them had to be shocked 6 times. 6 different times. And as you can imagine, this has an impact on your families, this has an impact on your workforce, this has an impact on the department, our service delivery, all those different things. So when we think about this is really important because we're seeing a trend here, right? We have these 3 members, relatively healthy, we know the statistics, so we have to do something about it. So in our department, on the other side of this, running into those challenges, we wanted to understand what can we do to be more preventative? What can we do to be more proactive? What can we do to help our members keep them safer? And this really led to us investigating a variety of different things. There are no real interventions out there that are, off the shelf, ready to go for us, so we have to kind of get creative and think about this. One thing to also understand is NIST has collected a bunch of different cardiac data on firefighters, and those the test data that they have shows that firefighters are different from the general population. So if we're running studies using data on the general population when we're comparing the fire service, we're doing ourselves a disservice because we're not using the right data. So in order to do this, we have to figure out what data sources can we use, where can we get them from, what are we going to do moving forward in the future? And so our department decided we're going to start to look to biometrics to see what we can do with this data and what we can collect. We're partnering with a startup in Chicago. They've been really great. They're very collaborative, and what we're doing is we're collecting this on a recruit class. So we decided to start with a recruit class because we can control some of those variables. We're able to collect baseline data from the beginning of their career, and we're also able to think this through in terms of their demographics are relatively similar. They've got a lot of different things going on in terms of us being able to control the variables related to some of the activities that they're doing and working through their career in the fire service. Really, the goal of this whole study is to look at preset alerts. So how can we alert our incident command staff? How can we help understand beyond just rehab? So a lot of times we collect data at rehab. It's been 20 minutes since you've been in the IDLH environment. It's a time point, but it's not telling the full story of these cardiac issues and these different health risks. And so really what this is all contributing to is research on a readiness score. So how are we looking at whether our members are actually ready to begin their job, to start their role, to be on shift. So that helps us inform training. So we're looking at these biometrics in comparison with caffeine intake, how well they've slept, speaking to those points earlier. And then really what we're doing is we're tailoring that. So we can change the training environment to match what our firefighters need. And the reason for that is you have to think about it this way. Training environments are working conditions for our instructors as well. So we need our members all around to be healthy and safe, and that's what we're doing. So instead of doing an 8-mile run, maybe we add in some yoga that day. Or if they're really running low on energy, we figure out different activities that we can help support their learning, because they're recruits, they're still learning. All 55 of them have voluntarily participated. Chief Downs is a really transparent leader, and he's communicated the importance of collecting this data to them. So that's really great. We have them voluntarily participating. They weren't coerced into this. But the one thing I do want to leave you with here is that at DC, it's really important for us at the Health and Safety Division to understand that we place equal importance on the health and wellness of our workforce and our community. If our workforce is not healthy, they can't do their job and they can't save the people that they need to save. So if you want to check out this QR code, this is our department's division page. It shows you all the initiatives we have going on. This is just one way we're thinking about this. We have a bunch of different things like a nurse triage line that DC has introduced. We have a sobering center, so we can reduce some of the burden on EMS personnel. It's really contributed to increased morale because we're not wasting hospital resources on something that doesn't need hospital level care. So I really appreciate the opportunity to talk to you today, and I'm happy to answer more questions or talk to you tomorrow at my session with Captain Binney and Chief Oates. Thank you so much.